in Rockland County, New York. It's the nation's first case in nearly a decade.
Fox 5's Antoine Lewis is live now, and Pomona with more on how Rockland officials are working to make sure that this virus does not continue to spread. Antoine.
Absolutely. The first of 2 vaccination clinics was held today. 18 people came out, including some who couldn't even remember if they'd gotten a vaccine the first time around.
I'm 64 years old, and I don't know when I got it and whether it was oral or not. The mark on my arm is even gone, so why not?
To that end, Todd Messler was among Rockland County residents getting vaccinated for polio on Friday. Rockland County officials set up this polio clinic after a confirmed case of the virus was announced on Thursday. Officials say it involves a young adult who was unvaccinated and did not travel outside of the country, but appears to have been infected by someone who received an oral polio vaccine, which hasn't been used in the United States since 2000. The State Department of Health gave Rockland's health department 300 extra doses to be added to the county's stockpile, extra efforts to reduce the possibilities of an outbreak.
Having a case come up in the county makes you question whether it's time for another inoculation.
Almost 76. I don't know if I ever had it. And so I just figured getting a shot would be worthwhile rather not get polio.
The polio vaccine was introduced in 1955 amidst the National Polio Vaccination Program. Cases were cut dramatically in the late 50s and early 60s. Most people are vaccinated against polio since the CDC made it part of their standard immunizations. But there are still some in the United States who are unvaccinated. The agency says that the last homegrown case of polio was in 1979, the last case brought by a traveler in 1993, and the last known case of any origin was found in 2013.
I had my OPV back when I was 2 years old. I think that was the last dose. So I'm fully vaccinated, but I just wanted to be sure that I had the newer vaccine. And just instead of getting blood work and seeing if I still had antibodies, I just prefer to just get vaccinated.
Regarding the case here, officials say that that person, a young man, is no longer contagious. A second clinic will be held, Teresa, on Monday beginning at 1 o'clock in the afternoon. 19 people have signed up.
The World Health Organization has declared that monkeypox is a public health emergency of international concern.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little.
In May, a rare case of the virus, which is closely related to smallpox, was diagnosed in the UK.
That first UK case, which was from a traveller in Nigeria, is now thought to be unconnected to the wider outbreak. But the UK went on quite quickly to report many more cases.
The virus has spread to more than 16,000 confirmed or suspected cases in dozens of countries, including the US and Canada, according to the CDC. The agency has said it's significantly expanding monkeypox vaccination efforts in the US. It recommends vaccines for people with presumed exposure to the viral illness and not just confirmed exposure. Here's what you need to know about monkeypox as the disease continues to spread.
Textbook monkeypox typically starts with flu-like symptoms. You've got a fever, headache, muscle ache, backache, and then a few days later you get a rash, normally starting on the face and spreading out, and it's a little like chickenpox. So it starts as these flat red marks. They become kind of pimple-like. In the current outbreak, there have been lots of case reports of pretty different looking symptoms. Some people are getting no rash, some people are getting very subtle rashes. A lot of times people are noticing a concentration of the rash in the genital area rather than starting in the face.
Scientists believe the main way monkeypox is spread is by close contact. Previous research found that monkeypox virus particles spread over short distances via respiratory droplets, but it's unknown whether monkeypox can spread by tinier airborne particles known as aerosols.
So there are high levels of virus in the pus-filled lesions that the disease causes, and contact with that is thought to be the main mode of spread. Monkeypox is much less easily spread than a virus that can be spread easily through the air, like COVID-19 would be an obvious example. But if you are in very close contact with someone, then it is quite easy to catch.
Over 2,800 cases have been confirmed across the U.S. Health officials found that monkeypox cases are concentrated in specific communities. Early data from the CDC show several of the U.S. cases were people who identify as gay, bisexual, or men who have sex with men.
The virus can infect anyone regardless of sexuality, but infectious disease experts think that the virus is exploiting very close contact between some members of this community to spread. This is the first time since the HIV epidemic of the 1980s that a newly emerging disease has cropped up and is concentrated in this community. One big difference between now and then is that while public health authorities were very slow to respond to the HIV epidemic, this time they are making a lot of effort to get the message out.
Most cases of monkeypox are on their own without treatment. However, there are some antiviral drugs and a vaccine that were developed for smallpox that also work against monkeypox. Danish vaccine maker Bavarian Nordic, which makes the only FDA-licensed monkeypox vaccine, said it will meet demand.
It's just like a traditional vaccine. It builds your immune system. It stimulates your immune system so you are better prepared to fight the monkeypox you are infected with.
Monkeypox was first discovered in lab monkeys in Denmark in 1958, hence the monkey in monkeypox. That said, monkeys aren't thought to be the main vector or carrier of the disease.
Scientists aren't totally sure what species is the main carrier, but it seems to be very widely circulating among certain rodents in the rainforests of the Congo Basin in Central Africa. And the first human case was discovered in 1970 in a 9-year-old boy in the Democratic Republic of Congo.
As of late July, more than 98% of confirmed monkeypox cases were in countries where the virus doesn't normally occur, according to the CDC. Deaths have been reported among the cases outside of Africa, but 3 people have died in Nigeria and 2 in the Central African Republic since the start of the year.
A child has died after contracting the highly infectious Marburg virus in Ghana, a World Health Organization official said on Tuesday. That death brings the total number of fatalities to 3 since the start of the West African country's first ever outbreak of the disease. The child, whose gender and age were not disclosed, was one of 2 new cases reported by the WHO last week. WHO Dr. Ibrahima Soche-Fall said one of those cases was the wife of Ghana's first Marburg case, the other his child. The WHO has previously said the first 2 cases, found in Ghana's southern Ashanti region, had symptoms including diarrhea, fever, nausea and vomiting before dying in hospital. Marburg is an Ebola-like virus that is transmitted to people from fruit bats. It spreads among humans through direct contact with bodily fluids, surfaces and materials. Ghana's outbreak is only the second in West Africa, with the first ever case in the region detected in Guinea last year.